Hello, seniors at the Providence Assisted Living. My name is Kat, and today I'm going to talk to you about fall precautions, how to avoid falls, and your safety. So, a few things that I would like to go over with you today. This includes identifying and understanding what your fall risks are, identify the strategies for fall prevention. I would like to identify with you the strategies for improving your physical strength and balance for better health outcomes. I would like to enhance your knowledge of the importance of nutrition and hydration. The last couple things we will cover is learning the proper usage of assistive devices and understanding what to do when a fall occurs. Because you want to be ready at any time. Ideally, you want to prevent falls, you want to keep yourself safe, and you want to maintain your independence as much as possible. However, falls do happen. If that happens, then you want to be ready to take the appropriate steps so that you can bounce back faster. So first, let's go over what are the things that put you at risk for falls. This can be things like balance and mobility impairments. Maybe you have an unsteady gait, problems with vision, people who can't see within certain distances or see double vision, or maybe the vision is cloudy. These are things you would want to address to help you avoid falling. Other problems could include like a foot injury or some kind of foot condition. Maybe you need some kind of device or a special shoe to help you move about more gracefully. Postural hypotension. Sometimes when people get up quickly, their blood pressure drops, they feel dizzy, lightheaded. So if that is something you're dealing with, that is something to address. Don't ignore it, address it so that something can be done and that problem will be alleviated. Another issue is the fear of falling. Sometimes when we're afraid of something and we operate more cautiously because of the fear and anxiety, we end up causing the problem. And it's okay if you're nervous about falling, if you have some anxiety around the issue. Empower yourself with knowledge and with the appropriate steps to prevent falls. So, some strategies for fall prevention, besides the proper knowledge, I highly recommend getting some exercise. What do I mean by exercise? Like strength training, cardio, things that help you keep your blood flowing, but more importantly, the strength training, because you need your muscles to help you get up, to help you move around. Even when you go to sit down, you use your muscles, okay? And then the other thing is your home environment. What does your home environment look like? Maybe it's important to make sure that your environment is free of cords. You don't have cords going in the middle of your floor. Or if carpeting is an issue, like small rugs, those are things that can contribute to your fall risk. Another thing to be mindful of is your lighting. I personally, when I leave my room, I rent a room in a townhouse. When I leave my room and it's dark, or I know it's gonna be dark when I come back, my light is on. I'll leave my light on so that when I come back, it doesn't matter what's going on, I can see. That's the big thing. You want to be able to see in your environment, and you also want to have your floors, your pathways clear and free from any obstacles. Okay, and then there's the use of assistive devices. Sometimes assistive devices can help us out a lot, and things like grab bars in your shower, or a shower chair, or a raised toilet seat, etc. We'll get into that later. So how can you improve your physical strength? How can you improve your balance? Again, strength training is key. If you strengthen your muscles, you strengthen your body. And then there are services like PT and OT. I highly recommend that if you feel you need to improve on your strength or your gait, your balance, just your overall physical well-being, look for those PT and OT services in your facility. I see PT and OT walking around. If you think that's something that could benefit you, make sure you say something to someone, your nurse or the ADON, and ask for those services because it can be very beneficial to you. Okay, so all this talk about growing your muscles, strengthening your body only works if you properly support yourself with the proper nutrition. It's important to stay hydrated, and it's important to make sure you get adequate protein intake. That's going to be at the top of your list. So your protein intake, there's different ways to get it. If you're vegan, vegetarian, maybe you don't want to eat meat, that's okay. There's other ways to get your protein in. Make sure you get your protein in. Make sure you get your fiber, your healthy fats like avocados, peanut butter. There's various things you can do to help your body so that it is equipped and well prepared to grow your muscles. Let's talk about assistive devices, okay? Especially in this setting, some of you have walkers, some of you have wheelchairs. Those things are important. There's no shame or shade behind that. If you need that and it helps you and it improves your quality of life, these things are important for helping keep you safe. Okay, so I highly recommend that you take advantage of these things. You have a walker, a rollator, a cane, wheelchair. These things are important. Again, when you're going to the bathroom, do you need a raised toilet seat? Because a raised toilet seat will help you so you're not like squatting down too much. You know, the lower you have to squat down, you know, you increase your risk of falls. So highly recommend a raised toilet seat. A shower chair can also be helpful, as mentioned earlier. And then also too, we have so many people around this facility. If you find that you need physical help besides these assistive devices, it's totally okay to approach your nurse or your med tech and ask them, hey, could someone please help me with this? Because I don't know if I can do it by myself. I'm struggling today. If you're just having a tougher day and you need a hand, you tell somebody. That's important. Also, I want to point out, when you're using the assistive devices, make sure that your devices are firmly in place. Make sure your grab bars are firmly attached where they need to be attached. Make sure your wheelchair is locked before you get into it or get out of it. Okay, rollators also have locks. Make sure those locks are in place because those locks are going to help create a stability for you. So, all right, it could happen, right? What happens if I fall? The first thing you're going to do is call for help. I don't care if you feel like you can get up by yourself. I want you to call for help first. Why? Because it's important that no matter what, you operate in safety. Safety improves your quality of life, and quality of life improves independence. So, call for help. Stay where you're at until people arrive, okay? Wait for help and do not get up by yourself. That's number 2. Number 3, you're gonna voice your pain, any injuries, any weird sensations you might feel after the fall, okay? It's gonna be okay if we address it. If you hide it, you could cause complications. But if you address it early on, it should be just fine, okay? That's important. Again, quality of life. Improved quality of life means improved quality of independence. In summary, you have a voice and you should use it, okay? You have power and you should use it. You have choices and you should make them, okay? Be proactive about your environment, your diet and exercise, and your assistive devices. Ask for help when you need help. If you're not sure, ask for help. Do the things that you know will promote your independence. If you take those small steps every day, you'll have improved quality of life and you'll maintain your independence, and that's what you want. Thank you for listening to my presentation. If you have any questions, I'd be happy to answer them. And also, I'd love to hear your feedback on what you thought.